All right, welcome back to ABA Exam Review. Today we're continuing our BCBA exam practice question series. Where we're going through our next set of questions together and breaking them down. Our set of questions today will be a little shorter than usual, but next week we'll be back to our regularly scheduled programming. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Be sure you check out behavioranalyststudy.com for all of our study materials, including our combo pack. As always, when you pass, let us know so we can include you in our Sunday shout out. Work hard, study hard. Let's get to our questions. Question 1. You are a behavior analyst working with a public university on handling trauma-fueled, escape-maintained behaviors in second graders. Your first job is to take baseline data on the participants. When would you not recommend that your colleagues began their intervention? Let's think about the question. When would you not recommend, the not question, that your colleagues began their intervention? So in one of these scenarios, you're going to tell your colleagues they shouldn't begin intervention, right? In the other scenarios, you would recommend it. And what is important here is what you are doing as this behavior analyst. Your job is to take baseline data. So it's really asking, what are you going to see, or what can you tell from the baseline data as far as starting interventions go? And we know our goal with baseline is really to achieve that stable state, right? We want that stable state of baseline if at all possible. But we know that's not always possible. So in some cases, we just have to begin intervention either way. But in some cases, we aren't going to begin intervention. And that's where this question comes in. When would you not recommend you begin intervention while taking baseline data? A, whenever the baseline becomes stable. Well, if the baseline is stable, that's a perfect time to start intervention. The ideal time, actually. B, if the baseline begins decreasing and the goal is to increase the behavior. Sure, if we want our behavior to increase and we see our baseline start decreasing, well, now is an okay to start intervention, right? Because the behavior is actually changing in the wrong direction. So be careful, because if you read this first sentence, right, you're on handling trauma-fueled escape-maintained behaviors, you can't assume that, well, we obviously want to decrease this. Not what the question is asking, not the information they're giving you. All right. This is a good question. You never want to make assumptions, essentially. Okay. So we're not sure what we want to do with this behavior, but it's not really relevant. We're just talking about the baseline data. C, if the baseline begins increasing and the goal is to increase the behavior. If your baseline is going in the direction that you want your behavior to go once intervention begins, well, there's no need to begin because the behavior is already changing in the way you want. So while it may not be the best scenario for your research, if the behavior changes without intervention, it's the best for the client. And that's really all we care about, right? So if that baseline is increasing, your goal is to increase the behavior, then there's no need to intervene. So when would you not recommend that your colleagues begin their intervention? Well, if your baseline is increasing and the goal is to increase the behavior. If that baseline is stable, absolutely intervene. If the baseline is moving in the opposite direction as your goal, intervene. But if that baseline is going the same direction, no need. Jack and Jill attend a football game in New Orleans. Jack and Jill have never been to a football game before. Prior to the game starting, the crowd starts chanting "Who Dat?" Jack and Jill, wanting to fit in, start chanting "Who Dat?" as well. The crowd could be described as what? So what are Jack and Jill doing? They're imitating, right? Jack and Jill go to this football game. They've never been before. They're sitting in the crowd, observing, watching, and the crowd starts chanting. So Jack and Jill, as people do, they imitate, they want to fit in, and they start chanting the same thing. So we know Jack and Jill are imitating. What does that make the crowd? What is the crowd now? Well, the crowd's going to be a model, right? Because we imitate models. Imitation works two ways. You have to have a model to be able to imitate something. So we know the crowd could be described as a model. Do we pick A and move on? Nope. We read all of our answer choices. B, a planned model. So a planned model is a planned, contrived situation where we are planning for imitation. We're designing the model so that something happens and imitation occurs. This is not planned, right? Jack and Jill have never been to this game before. They did not plan the crowd for Jack and Jill. It just organically happened where Jack and Jill saw these crowds and they started imitating. So the crowd's really functioning as C, an unplanned model. So yes, the crowd is a model, but the crowd is also C, an unplanned model. So our answer here is going to be D, both A and C. My friends who come to Vegas to visit on weekends sometimes like to go out and gamble at the casinos. One friend is an exception. This friend says that he lost the first time he played a slot machine and now refuses to gamble ever again. The slot machine functions as what? What has happened here? What has happened with this slot machine? Well, the friend, he went up to the slot machine, put his money in, lost. Okay. Usually people continue to gamble if they win, right? Winnings become that positive reinforcement to continue gambling. I bet money, right? I win money. I'm continuing to gamble. This friend lost all his money, never gambled again. That behavior decreased, right? So what is the slot machine functioning as? A, an SD for reinforcement. Well, has that slot machine ever produced reinforcement in the past? Has reinforcement ever occurred for this friend when the slot machine was the SD? No, so it can't be an SD for reinforcement, right? The slot machine does not signal reinforcement is available to this friend, making it be an S delta for reinforcement. And as delta signals that reinforcement is unavailable. And that's what the slot machine is doing to this friend. Some people see that slot machine and they see reinforcement. This friend sees that slot machine, they don't see reinforcement. If anything, they see punishment, right? C, S delta for punishment. Well, it's not going to function as an S delta for punishment. If anything, it's an SD for punishment. SD, the discriminative stimulus or stimuli, signals reinforcement or punishment are available. S delta signals they're not available. D, an unconditioned stimulus. Well, the slot machine is now conditioned, right? Because of the learning history. The slot machine is actually functioning as an S delta for reinforcement. When that friend sees the slot machine, it is signaling to that friend that reinforcement is no longer available. If anything, the slot machine is signaling punishment is available, meaning he's never going to gamble again, right? One time was enough to reduce that gambling behavior. So the slot machine is functioning as an S delta for reinforcement. Timmy likes to fake snore in class to make his friends laugh. On Thursday, his teacher took away Timmy's basketball privileges for the day, and Timmy did not snore for the rest of the month. After the class, Timmy told his friends that he chose to stop snoring because he didn't think it was funny anymore. Teacher's consequence function as what? Now, how do we determine what consequences are, rather reinforcement or punishment? We've got to look at how the future behavior changed. So regardless of what Timmy claims and what he tells his friends, the consequence changed his behavior. Remember, consequences, people don't need to know, okay, they're being reinforced or punished. All that matters is how that behavior changes. So in this case, Timmy's fake snoring. So teacher took away his basketball privileges. And what happened to Timmy's behavior? Well, he stopped snoring. His behavior was punished. His behavior was reduced. So we know it's going to be a punishment procedure. Now, was something added or something was taken away? Well, we know the teacher took away the basketball privileges. So is that positive or negative? It's negative. Positive, we're adding something. Negative, we're taking it away. So if we take something away, which reduces behavior, that's going to be negative punishment. So the teacher's consequence functioned as negative punishment. Again, it doesn't matter what Timmy claims about why he stopped snoring or whatever it might be, okay? The fact is, once his basketball privileges were taken away, his behavior decreased. The maintaining consequence or the punishing consequence was the removal of these basketball privileges. It reduced his snoring behavior. The basketball privileges being taken away functioned as negative punishment. A functional analysis conducted with a 6-year-old client indicates that their behavior occurs across every condition several times per day, except for the demand condition. 6-year-old client is typically compliant with low rates of aggression. What would you hypothesize is the function of this behavior? All right, a lot of words, kind of a longer, convoluted question. Let's just deep breath, break it down. Okay, our goal is to hypothesize the function of the behavior. We know we're performing a functional analysis. Best way to identify a function, and in our functional analysis, indicate that the behavior occurs across every condition except for the demand. Now, that's the key giveaway here, right? If our functional analysis graph indicates, if you can picture it in your mind, if it indicates that on every condition, this behavior is happening, On the demand condition, it's not. What are we going to say is the function of this behavior? A, attention. Well, maybe, right? Because it is happening in the attention condition, but it's also happening in the tangible condition, right? It's also happening in several conditions. Okay, so we can't definitively say for sure it's one function alone. Well, we know though it doesn't happen in the demand condition. So when behavior occurs in a functional analysis across all conditions except for the demand condition, typically our hypothesis is going to be that it's an automatic function. And that's kind of true, right? Because behaviors can have multiple functions, okay? But in this particular scenario, especially where it's occurring across every condition except for demand, we're going to hypothesize the function of the behavior is automatic. What should be the terminal behavior when conducting man training with a client? Now, what do we mean by terminal behavior? Well, if you think about shaping, terminal behavior is that final goal, right? The final behavior we want to see. So if we're talking about terminal behaviors for manned training, that's going to be the ultimate goal, the ultimate outcome, what we want to see for man training. What are we trying to accomplish with man training? Well, we're trying to teach our client to make requests. We want them to manned. What's that terminal behavior look like if we successfully teach them that? A, stimuli will control mands from the client when the client sees certain stimuli. Now, is that the goal for them to see a cookie and say cookie all the time? Or to see a PlayStation and say, I want PlayStation all the time? Is that the goal with man training? Well, no, because the stimuli isn't necessarily what evokes the mand, right? You got to remember what evokes our mands. B, motivation for certain stimuli will control client mands. Good. Mands are evoked by MOs, by motivating operations. Our goal is that mands are controlled by motivation, by motivating operations. If we can get to that point, we've successfully man trained. C, the client will always say, I want when manding. Well, that's not necessarily true. Okay. They need to be able to make requests in many, many different ways if we wanted to generalize. And then D, the client will appropriately respond to questions like, what do you want? Questions do not evoke mands. What do you want? And they say train is an interverbal, right? The mand, again, is evoked by a motivating operation. If we are successful man training, that terminal behavior is going to be that motivation for certain stimuli will control client mands. So our answer is going to be B. What should be the terminal behavior when conducting man training with the client? B. Motivation for certain stimuli will control client mands. All of the following approaches could possibly work at increasing the behavior of eating vegetables, except for what? Okay, let's think about this. We want to increase a behavior. Now it's eating vegetables, but regardless, we want to increase a behavior. Think about our different approaches where we could increase behavior. And if we look at our answer choices, we're talking about different measurements. So if we A, decrease the inter-response time of eating vegetables, could that increase eating vegetables? Sure. If I take 10 minutes in between eating carrots, and then we decrease that to 7 minutes between eating carrots, then there's a good chance that I'm eating more carrots now, right? Because I'm eating more carrots in less amount of time. B, decreasing the rate of eating vegetables. So if we decrease the rate, what is rate? Rate is frequency over time. Okay. So if a rate is very high, it means something is happening a lot. If you decrease that rate, you're either decreasing the frequency or increasing the time. So if you're decreasing the frequency, well, you're definitely not increasing the behavior. And if you're increasing the time, you're not increasing how often that behavior is happening either. So B doesn't seem like it's going to necessarily work to increase our behavior. C, increasing the frequency of eating vegetables. Sure. If your frequency goes up, you eat more vegetables, well, what happens? Well, you eat more vegetables, right? It's simple as that. And then D, increasing the percentage of opportunities of eating vegetables. So what does percentage of opportunities say? Well, percentage of opportunities says you have 10 opportunities to eat vegetables, you eat them. You eat 6 times. If we increase that and you have 10 opportunities and you eat 8 times, well, then yeah, your possibility of eating vegetables has increased. So the only approach here that's not going to work at increasing the behavior of eating vegetables is going to be B, decreasing the rate of eating vegetables. All right, that was a shorter set of questions. We'll be back to our normal set next week. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials. Let us know when you pass so we can include you in our Sunday shout out. Work hard, study hard. See you soon.